my name is Nitish and I'm one of the Associate Course Directors for MSc Global Healthcare Management course at Coventry University. So my role is looking at managing the overall course in general and looking at the management side, as well as lecturing on the course, module leading several modules on the course. I think the course is very much tailored to leaders and managers in healthcare, looking at becoming leaders and managers in healthcare who are also clinicians or maybe healthcare professionals by background. I think the course is tailored to largely the people who want to work in leadership positions, leadership roles. I think it's a combination of both. If you look at the course in general, it's tailored to, like I said, people who are clinicians by background and whose ambitions are to transition into a leadership role. I think that's what the course does, is to train them, equip them with the necessary skills and sort of skill set that they need to be leaders in a healthcare setting, be it not just maybe in the UK we could specifically say the NHS, but not just the NHS on a global scale, because the course itself is Global Healthcare Management, which equips them with leadership skills to lead healthcare organizations. Entrepreneurship is also a key skill that healthcare leaders in today's challenging, dynamic, volatile healthcare environment need to have, because I think it's always changing and change, as we all know, is the only constant. So I think they need to develop that skill set so that they can take in challenges as they come, think on their feet, probably develop skills that would enable them to engage and support and come up with strategies that can help them to lead effectively, essentially. And I think entrepreneurship is one of those skills that is a part of the course. It equips or actually guides people who are trying to become future leaders in terms of developing strategies in a VUCA environment. By VUCA I mean volatile, uncertain, complex and ambiguous. But strategies are a key part and play a key role in sort of looking at not only just immediate challenges that leaders might face, but also challenges that may face in the next 5 years or next 20 years period of time. So not just looking at short-term strategies, but also looking at long-term strategies. So that specific module equips them with sort of leadership skills, leadership behaviors, leadership theories, looking at short-term, medium-term, long-term strategies, development plans. They can look at finding out alternative solutions. So there's something called as an options appraisal that leaders do. So to look at what's the best solution. They could use a lot of management tools to find out, for example, a SWOT analysis, which actually helps them to evaluate and weigh their options. They could actually do and learn more management tools in that module, specifically a Fishbone Analysis, which actually helps them to figure out the root cause of the problem before they actually get onto the solution part of the issue. It's a management tool that leaders often use in sorting or finding the root cause of a problem. Well, in other words, you may also call it a root cause analysis. So a fishbone or a root cause is to figure out or to flesh out what's the actual root cause of the problem. So there could be contributory factors to a problem. People not maybe usually look at the problem, but not the causes of the problem. So they can look at the problem from a political angle, an economic angle, a social angle, a technological angle, a legal angle. They could also do a PESTEL analysis to do that. So CMI stands for Chartered Management Institute, which is an additional qualification that they will receive alongside their master's degree. It is accredited and attached to the module and the course. So in today's world, I think they could be using that qualification to their own benefit, because it's a very useful thing to have in addition to their master's degree. The course equips people with the skills that they should have to actually adapt to the changing business needs of the healthcare environment. So if you do the course and you think that it's just about theories, or is it just about a lot of literature that you've got to read, I would not necessarily agree. It is about the skill set that you would develop throughout the course that will actually help you to adapt yourself in those uncertain environments. Healthcare is always a very challenging field. It is in itself a very complex environment to operate in. The course then enables these future leaders and managers to sort of look at healthcare as a dynamic field which they can work in, adapt to those challenges, come up with solutions, come up with strategies, and develop something which is concrete and can be again changed as per the needs of the population. On the MSc Global Healthcare Management, we largely have a lot of international students who are usually coming from all around the world. Their backgrounds, largely they are linked to or related to a healthcare background, because the course is kindly tailored to professionals seeking or trying to transition from a clinical background into a management setting, which could be either a leadership role that they're looking at. There is a lot of discussion, which is, I think that is an asset to the course, because people are coming from various walks of life who are actually clinicians. Some of them are pharmacists, some of them are nurses, some of them are dentists, some of them are medical doctors, some of them are people working in a different side of a healthcare setting. Some of them could be managers actually in a healthcare setting, but trying to be maybe now progressing towards the senior leadership or management role. These recent graduates are employed in healthcare organizations. Lots of them are in government organizations. We've had one of the students who was an alumni working for the WHO. There was somebody from China who went back to China and now works as a policy advisor for the Chinese government. The possibilities are endless. 3 skills that they might be able to develop when they graduate from the course is, first of all, effective decision-making skills. I think that is a key skill that a leader or manager should have. Second is effective communication skills. I think that is one of the key skills that they would master and develop. And I think the third skill that they would master on the course is teamwork and negotiation. The course is about healthcare management, and people largely are enrolling on the course who want to be healthcare leaders and have ambitions to be working in a healthcare setting. If they've got a healthcare background, it's advantageous. We would have to see otherwise what's their background. If they're a nurse, if they're a dentist, if they're a medical doctor, if they're a pharmacist, if they are working in a healthcare setting as a manager already, but would like to progress to a senior leadership role, I think that would be quite beneficial for them to understand some of the terminologies that we use on the course.